Today I'm gonna present about the topic investigation of biphasic calcium phosphate with various reducing appetite and beta T calcium phosphate ratio under the artificial saliva condition. The presentation has 4 sections, but I'm gonna present about the introductions. So, in the human body, most calcium phosphates exist at the compound named reducing appetite. Which they are the product of the reaction between the calcium and phosphate and can be described as the specific restore form of a mineral. This is the combined with the organic compounds, mainly the protein type 1 and some non-collagenous protein and water to form the heart tissue. Some heart tissue such as the bone and dentin or the enamel, they are closely related in several ways, including the composition and construction, but they are different in some proposition compounds. Therefore, the damage to the heart tissue cannot be avoided. Especially in the oral environment, the dentin hypersensitivity is a typical case in the own type of ages. It can caused by the erosion of the appetite layer that covered during the dentin. To be more specific, on the bottom right of this slide, in the cross section we can see the dentin tubulus, and along the dentin tubulus is the cytoplasm that contain the nerves with the sensing function. There are many materials used to repair these injuries. Among them, there are 2 distinct compounds, the reducing appetite and the beta-G calcium phosphate. They are both bioactivity, biocompatibility, and a high degree of viscosity. For that reasons, it has the osteoconductive properties, which means that it can elicit the bone repair. However, because the reducing appetite is a significant component of the heart tissue, which means it is very stable in the body environment and difficult to be absorbed, it can be used to fill the defects. In contrast, beta-GCB is easily absorbed by the human body and can release the 2 ions of the heart tissue, the calcium and the phosphate ions, to help repair tissues. The 2 compounds combine to create the 2-phase compound that called BCBs, which has the total properties of each phase, because each composed of each component changing each phase will affect the material properties, so the potential of BCB is unlimited. So here is the commonly seen modifications units are shown in this diagram. As mentioned, depending on the percentage of each phase will change the degradation. After implanting the materials, the new bone gradually will replace the implant with the graft resorption, graft degradation, so the properties can be affected by the material reaction time, the temperature, or the initial molar of calcium and phosphate ratio. This also affect the scaffold morphology, such as the shape, the surface roughness, tensile, or the porosities of materials. All of these have the cell here to the material to facilitate the healing process. All of these create the dynamic interaction of BCB with the biological environment and have the heart tissue regeneration. So this following chart depicts the main interaction of the restorative material. Firstly, after immersion the material, the dissolution surface of the material will cause the supersaturation of calcium and phosphate ion, and incorporated with some it can cause the deposition of the calcium and phosphate on the surface to create the exhibition of the biological appetite players. So these combine with some sodium, magnesium, and protein to have the forming the bond line appetite players. So because the biomaterial are known to bond to the living bond in the human body through the formation of the appetite layer on their surface. When they are implanted into the human body, the appetite form at the surface and the newly born will form to interact with the surrounding materials. So this can be indicate the essential requirement for the material to bond to the living bond, and on the other hand, to study about the effect of the BCB with the body fluid in the oral environment. The artificial saliva is also right choose to study about the behavior of BCB. On the other hand, this study focused on the effect of the various ratio of phosphate in the BCB, but not focus on the hydroxy appetite player forming. So therefore, this prerequisite is to investigate the behavior of BCB with various ratio of hydroxy appetite and beta calcium ratio under the artificial saliva condition.